Hello, my name is Allison, and I am a nursing student at the University of Michigan Health System. I am going to be giving a report on a recent patient. Patient is a 20-year-old Caucasian male who works as a pharmacy technician and youth director. On February 10, 2017, he presented to the clinic with symptoms of a cold. Patient reports that it is hard to breathe out of his nose. Symptoms began on Tuesday, February 7, 2017 in the evening. At this time, the patient says that his symptoms are aggravated by laying down and alleviated by supine position or hot showers. Patient has been taking pseudoephedrine at home as treatment for his cold. Other than excessively blowing his nose, the patient says the cold is having no impact on his activities of daily life. Patient is not using any coping strategies and has no emotional response to his illness. Health history. Past medical history includes type 1 diabetes and depression. All immunizations are up to date, including an annual flu shot. Patient has no known drug allergies. Past surgical history. Surgical repair of the lower lip following an accident and numerous hospitalizations for treatment of type 1 diabetes. Patient is on numerous medications for type 1 diabetes and depression. Patient takes metformin XR 750 milligrams by mouth in the morning with breakfast. Patient also takes Celexa 10 milligrams by mouth at bedtime. Patient takes Humalog 100 units per ml with a 1:8 carb ratio and a 1:20 correction ratio with a target blood sugar of 120, taken subcutaneously with meals and at bedtime. Lastly, the patient is on Toujeo 300 units per ml. 65 units taken subcutaneously twice a day, in the morning and in the evening. Functional assessment. Patient denies smoking and illicit drug use. He states occasional alcohol use approximately 1 time per month when he consumes 3 or 4 alcoholic beverages. Patient states he does not have an exercise regimen. He also notes an irregular sleep schedule ranging from 4 to 8 hours per night. Patient denies any eating difficulties and states that he drinks 3 to 4 caffeinated sodas per day. Patient reports always wearing his seatbelt in the car, avoiding tripping hazards, and not engaging in high-risk behaviors. Psychosocial assessment. Patient currently lives at home with his mother and father. Patient states he has a lot of support from his family and those at his church. Patient's parents, brother, paternal grandparents, and maternal grandmother are still living. Patient admits some self-esteem and body image issues associated with depression. Coping mechanisms include talking about situations with others and sleeping. Patient denies other outside stressors. Patient and his family are very religious and identify as Baptist. Patient is working towards earning his bachelor's degree. Patient says he will seek medical assistance if a problem is severe or if it persists for more than 1 week. Family history. Patient's mother has a history of complex migraines and depression. Patient's father has diagnosed erectile dysfunction. Patient's brother has undiagnosed learning disabilities. Patient's maternal grandmother has depression and type 2 diabetes. Patient's maternal grandfather died before the patient was born due to a heart aneurysm and had a history of skin cancer. Patient's paternal grandmother has a history of breast cancer, and paternal grandfather has a history of colon cancer. Review of systems. Given the patient's diagnosis of a seasonal cold and history of diabetes, it is important to assess his integumentary system and peripheral vascular system. Overall, patient describes himself as overweight and states that he is not satisfied with his health. Patient says his weight is increasing and he has gained 20 pounds in the last 6 months. Patient does not experience any fevers, chills, night sweats, excessive fatigue, or heat or cold intolerance. He states he has extreme dryness on his feet and has had it for years. Patient is itchy because of the dry skin and rates the pain as a 4 on a scale of 1 to 10. Patient has no skin conditions which he is concerned with. Patient has not spent long periods of time in the sun but uses SPF 30 sunscreen when he does. No changes in the hair, nails, or skin have been noticed on the part of the patient. Patient says he experiences pain in his calves when walking on inclines. Patient reports that his hips pop and he has knee pain rated as a 7 out of 10. Patient says he has not noticed any swelling, coolness, or hair loss on the extremities. No history of blood clots. Few varicose veins were found during my assessment, specifically on the back of the thighs. Physical exam findings. Vital signs. Blood pressure, 138/76. Heart rate, 84. Respirations, 20. Temperature, 96.7 degrees Fahrenheit, taken orally. System 1, integumentary. Skin is symmetric with no bulging or masses present. Skin appears clean and free of excess perspiration or body odor. Skin is noted to be excessively dry on the hands and feet. A secondary lesion of a scar is present on the right knee from a previous injury. Skin tone is consistent with genetic background and paler on areas not exposed to the sun. Skin is firm, smooth, dry, and consistent in color across the body. Thickness and texture are appropriate for age. Skin is warm to the touch and equal bilaterally. Good skin mobility and normal turgor are present. No edema is present. Patient scored 23 on the Braden scale and has no risk for developing pressure ulcers in his current condition. System number 2, peripheral vascular. Patient has diabetes, which can slowly affect the nerves in the hands and feet. Therefore, it is important to conduct a peripheral vascular assessment. Patient says circulation feels cold and reports no paleness or blue appearance of the extremities. Patient states the circulation in his upper and lower extremities has not changed in the last 2 months or 2 years. Patient has not noticed any changes in skin on the arms, hands, fingers, legs, feet, or toes. No changes in overall temperature were noted. No sores or ulcers were present on the legs. Patient says he has a tingling sensation in his lower legs and feet after being on his feet for a long time, specifically more than 4 hours. Patient has not noticed any changes in the hair growth on the legs. Patient is not aware of any swollen glands, and none were found during my examination. Patient also reports he has no difficulty achieving erection. Patient denies smoking and says he does not exercise regularly, other than the normal activities of daily life that involve walking. Other pertinent systems. Pertinent system number 1, heat. According to the American Diabetes Association, it is important to assess heat because diabetes can have negative effects on the head, eyes, ears, nose, and throat. Individuals with diabetes are at a higher risk for developing glaucoma due to the excess blood sugar in the bloodstream, which can build up in the trabecular meshwork of the eye. Pressure within the eye then increases, putting pressure on the optic nerve, which can cause vision loss or blindness. Pertinent system number 2, cardiovascular. According to the American Heart Association, it is important to assess the cardiac system. Adults with diabetes are 2 to 4 times more likely to die from heart disease than adults without diabetes. Moreover, diabetes is able to be controlled, and with better blood sugar control, the risk for cardiovascular problems decreases. Thank you.